In my talk, I showed a graph of the history of the cost of healthcare as a percentage of GDP for all the OECD countries, basically all the rich countries. And you see them going up in lockstep over from the 1960s, the 1970s, 1980s. And there is a period that is really obvious where the United States has a different trajectory, takes off much steeper. That moment is when we introduced codes. It was thought of as a cost-cutting measure, keeping the costs under control. What it actually became, when we introduced DRGs and CPT codes into healthcare, they spread through healthcare, what it became was a manual for success. If you wanted to know how to make more money in healthcare, you began fooling around with those codes. You figured out how to bill at the top of the code, how to look for more complexity, how to use new technologies, because a new technology would always get a new code, and it was always higher than what it replaced. And that never went down, even as you made the new technology more efficient and more effective. So you see this climbing over time. And what this tells you is this system of codes and the ability of the industry to lobby, to regulate, to help get involved in the regulation of these, to actually manipulate the system is at root why our system costs twice as much as anybody else's. Which means that if you change the way you pay for healthcare, almost all of healthcare now is still paid through DRGs and through codes. If you change that to bundled payments or anything else like that that pays for it differently, in which you can actually get price and quality signals through the market, that will implode today's healthcare market and lead to drastically different ways of competing, ways of bringing our products out there. This is the shape of this future, and that's why these buyers who are looking precisely for that ability to send a price signal and quality signal right into the market to the providers and get them to compete on price and quality as in any other market over our products, that is exactly what they're trying to do. So this is arising right now, and it's going to be expanding rapidly over the next decade.